Tonight, in the Alfred Hospital's intensive care unit.
Simon, can you give my fingers a squeeze?
This is a seizure.
A fair proportion of epilepsy we still can't control.
Even though we've been in hospital thousands of times, it's still a shock to see him in this state.
She's lost a lot of blood.
She was a passenger and the car was hit by a ute. She's very unstable.
The area where they've taken the bone off, we could literally see that swelling.
She's still my little girl.
Good morning, Charlie. You in with the ICU doctors?
Despite the fact he's never smoked, he's developed this chronic lung condition.
Preparing ourselves for the worst, we were actually talking about a funeral.
The sickest patients, the most advanced technology, medical care second to none. It's always a matter of life or death.
Second CT brain yesterday looked worse than the first one.
In the trauma pod, the ICU team is fighting to keep 19-year-old Christy alive.
Christy's a young lady who last night was involved in a high-speed car accident. She was a passenger and the car was hit T-boned from the side by a ute. Ambos reckon going about 80 miles an hour. She was trapped quite severely in the cabin of the car.
Christy has 19 separate injuries. Multiple breaks in both her feet and legs, fractures in her pelvis and lumbar vertebrae. She's bleeding from a kidney, has broken ribs, a punctured lung, fractures to her skull, and diffuse bleeding in her brain.
The two main injuries we think are her brain injury and lung injury. Both are quite severe. She's a high risk given the state of her other injuries.
Christy's brain injury is life-threatening. The swelling in her brain must be brought under control before she can safely have her other injuries treated.
We have to fix her posterior pelvis with a screw, but if she's so unstable like she is at the moment...
Very
unstable? Yeah, very.
Oh, yeah, she's...
So what's your concern, chest or mediastinum?
Head and blood pressure.
Doctors have put a drain into Christy's skull. This is like an escape valve for the brain fluid that's under pressure from her swollen brain.
And we'll keep her cool.
Putting Christy on a cooling pad will also lower the brain pressure.
That's her temperature, and that's the blankets cooling to bring her down.
She's lost a lot of blood.
The team is giving Christy the best care.
She's very unstable.
But it may not be enough.
I don't know what's going on underneath.
Oh, she's critically ill. She is critically ill. I've just had a chat with the family. I've explained to them that we will do our very best for Christy. There is a chance she may not make it through this injury.
Simon's mother.
Hi.
32-year-old Simon has had severe epilepsy for most of his life.
It's Mum, love.
Last night, his seizures were so bad, his family had to call an ambulance.
You're in the Alfred Club, and you're being looked after really, 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 really well.
When Simon has a seizure, the nerve cells in his brain are firing 4 times faster than normal. It creates a kind of electrical storm in his brain and can cause him to collapse in convulsions.
Simon, can you open your eyes?
Prolonged epileptic seizures can cause brain damage.
Can you give my fingers a squeeze?
So Simon has to be heavily sedated until he stops fitting.
Simon, I'm just going to have a look at your eyes, okay? A fair proportion of epilepsy we can control very well. There's a very small percentage that have problems with very brittle seizures that despite all the medications that we have now, we still can't control, and Simon is one of those cases.
Simon's seizure threshold is so low that this time it was just a mild chest infection that set them off.
Even though we've been in hospital probably thousands of times since he was 7, it's still a shock to see him in this state. It's never been this bad before. Every aspect of his life has been affected by this illness. For years he's been unable to play sport or get involved in theatre or anything because as soon as people realise he has epilepsy, that's it.
But Simon hasn't given up on life. He's become a keen amateur singer. So it's unfortunate that the breathing tube keeping him alive while he's so heavily sedated could damage his vocal cords.
His singing voice is the the one thing that he's good at in life, and I just pray that he's not in that tiny percentage of the population who's affected by this, the intubation. Is he coming around now?
Yeah, we've just turned the sedation down.
Can he understand when we speak to him?
I've been talking to him and telling him what I'm doing.
Yeah. Oh, that doesn't look good to me. Because that's what he does when he has a seizure. This is a seizure. This is a seizure. It is a seizure.
Simon's in the best of hands. But his mum knows that the longer a seizure lasts, the greater the risk of brain damage. In the cardiothoracic pod, the ICU team is caring for 56-year-old Charlie, who has had a double lung transplant.
Charlie's been in theatre most of the day, and the lung transplants went successfully. And despite the fact that he's never smoked, he's developed this chronic lung condition, which has been under control by respiratory physicians for quite some time. And the fact that he's on home oxygen usually means he's at fairly end stages of disease, and without a lung transplant, his life would be considerably shortened.
Charlie's had this unexplained lung condition for nearly 20 years. But over the past 12 months, he's been really sick.
We were actually talking about a funeral and, preparing ourselves for the worst.
Charlie, wiggle your toes for us.
Now that Charlie's had his transplant, he needs to be awake and coughing to clear the secretions from his lungs. But he's been an invalid for so long that his fitness is very poor, and that's hampering his recovery.
Can you squeeze my fingers?
He's extremely weak, and so Charlie's finding it very hard to wake up. I know that you probably feel a little bit uncomfortable at the moment and you can't move as much as you would like, but you're in good hands, okay? And we're here with you all the time.
The longer Charlie's only semi-conscious and lying flat on his back, the greater the danger of infection. Over in the trauma pod, Christy's still critical and the swelling in her brain shows no sign of letting up. Her parents have had 3 terrible days.
I knew she had some broken bones, but we didn't know the extent of her brain injury till we got in here.
A car drove up my driveway and she said to me, your daughter's been involved in an accident down in the intersection and she's trapped in the car. So I got there pretty as soon as I could and actually crawled into the wreck with her. Just tried to reassure her. Christy is my first, and as a lot of proud fathers will say, it's Daddy's little girl. Well, she's still my little girl. I thought I'm a pretty strong person, but this has just floored me.
There's every chance Christy won't make it. All her mum and dad can do is be there and pray. In the Alfred's ICU, Simon hasn't had an epileptic seizure for 24 hours.
My understanding is that they've increased the anticonvulsives overnight, and they think the next step, they'll try to bring him round and remove the tubes.
Very soon that'll be out. I'm here with you, OK?
Sounds like everything's been good overnight. All of the numbers on there look perfect. So, time to wake him up, get a tube out.
Right.
Even though Simon's improving, he could have another seizure at any time. The team has to watch him closely.
Not for a little while.
Don't try and talk.
In the cardiothoracic pod, it's 8 days since Charlie had a double lung transplant, and his progress is disappointingly slow.
Right, well, Charlie didn't really have a great night's sleep, so he's very tired, which affects his breathing. He's not breathing as strongly as what he could, and he probably still needs another day of using the ventilator. So it's disappointing for the family. They thought Charlie might be off the ventilator today.
Just a waiting game.
Do you want to ask something, Dad? Do you want me to rub your feet? That's what I'm here for. I'm the foot masseuse.
Everything's going pretty well, though. Just got to learn to breathe deeper.
One day later, Charlie's got the breathing tube out.
That's all very positive. We're just everyone's just fine-tuning a few little things, and then hopefully in the ward in a day or two. We've done very well.
Thank you. Well, we've done good now. What next year, a couple of days, and now that's out. Fantastic.
Morning, Charlie.
But just as Charlie was moving forward, he's had another setback. He went downhill overnight, and now he's back on the ventilator.
After having a very strenuous, tiring night, breathing, he became really tired, and if we didn't intervene, he would have probably gone into respiratory arrest at some point.
He's probably quite weak, and I suspect that over the next little period of time, we're going to have to do a tracheostomy. That basically is just putting a small hole into the windpipe so that we can take the tube out of his mouth and put it directly there. It's a lot more comfortable for him because he hasn't got all these things in his mouth.
He's clearly going to need a slow wean from the ventilator. That will be a much gentler transition, I think one he'll be able to deal with. And so that's inside the trachea. You can see there's no blood, no bleeding. We're midline. We're out of here. Just having a look at your eyes here, Christy.
It's 8 days since 19-year-old Christy's car accident, and the swelling in her brain is getting worse.
Christy's condition is critical by any definition. She remains on very heavy sedation in a medically induced coma.
The vibe is, I guess, at day 8, we're not making progress, perhaps, like we would like to. And we're still requiring high level of support.
Christy may not survive, and if she does, she could be severely brain damaged. It's important her family understands this.
Really, I guess the overriding concern is the brain. The CAT scans don't suggest that anything's worsening, but we're still left with the problem of a pressure that's not quite controlled as well as we would like. Okay. I guess what you'd like to know, what we can't answer is, you know, how is she going to be down the track? There could be damage and disability.
Obviously, we don't know what extent.
No, don't know.
The professor did tell me he was optimistic, so I'm hanging on to that word.
Absolutely, and I guess we're all hopeful. What's on her side is age. She's young, but she certainly had a significant head injury. We just need to get her through this acute stage, and we'll see what the future holds.
If the team can't get Christy's brain swelling down, her family will have to make some very tough decisions. Charlie's been in the Alfred's ICU for 19 days, and finally, he's made some real progress.
So, are you able to? So, if you had a glass of water, would you be able to swallow it? The tracheostomy doesn't get in the way. You're not too far from getting both those tubes out. It's going down the right way. That's fantastic, Charlie. You look great.
Ward today?
Yeah, ward today. Trachea out tomorrow or Saturday. Fantastic.
I'm ever so grateful that they donated these lungs, because without them, my life was finished. And my grandkids are all too little to actually, by the time they get older, they won't remember me, because the oldest one's only 5. And I doubt that he'd remember me when he's 15.
He's off to the ward, but Charlie's looking at months of physio before he can get back to his grandkids. Simon's been in the ICU for 2 days. For the last day, he's had the breathing tube out and he's been awake without any more seizures.
I really don't know much what happened.
Having such severe epilepsy has really disrupted Simon's life.
It's certainly done a fair bit with my participation in sport, for example, and employment. If I ever wanted to try and get work, It was... everyone just seems too scared of this whole problem. It is very frustrating, yes.
But the singing's the big plus, isn't it, Si?
It's something which I really couldn't do without for the moment. It's a fantastic hobby to have. I really love it.
My name's David. You won't remember me, although I've seen you in the last couple of days. Right. How are you feeling?
Oh, a little bit sore, but generally it's starting to get better.
Good. Looking at you, you're definitely well enough to get out of the intensive care.
Good. That's going to be great. Oh, yeah.
Even though Simon's well enough to go to the ward, he won't know if the breathing tube has damaged his vocal cords until he's fully recovered.
Ready,
15 weeks after his transplant, Charlie is back at the Alfred for an outpatient's visit. He's had 3 months of physio and, despite his shaky start, he's doing great.
Yeah, I'm breathing pretty good. 15 minutes on the bike.
Yeah.
I'm feeling the best I've felt for 20 years. Absolutely fantastic. Well, we're not looking at a funeral anymore, which we were looking at. Before that was the only other option. Now I'm looking at a whole new life, starting off again and going again like I was 20.
Christy's been in the Alfred's ICU for 2 weeks, and she's getting worse.
She appears to be breaking down a lot of her muscles, and the toxins from the muscles are causing her kidneys to fail. The best way to get rid of those is to put her onto a dialysis machine now.
And you're going to do that?
And I think we should do that. And the dialysis takes out those toxins. Once the muscle breakdown stops, then the production of toxins will stop as well.
Good.
And then we'll be able to hopefully stop the dialysis, and her kidneys will work for herself and won't get any more damage. I don't think we should wait. I think we should actually put the dialysis machine on.
The sooner we clean the toxins out, the better.
But I'm really worried about it. I'm really worried.
We'll be here.
How critical is she? She's very critical. It's a sort of difficult phrase to use. She's very, very sick, and I don't know whether she's going to get better at the moment.
Time is running out.
Catch you later.
Okay.
In theatre, Professor Rosenfeld is performing an emergency craniectomy on 19-year-old Christy.
What we've done is to take off the front and sides of her skull because she got problems with very high pressure inside her head this morning in ICU, and we were very concerned that if we didn't do this that she would die.
It might seem extreme to remove a big piece of skull, but with nowhere else for the swelling to go, Christy's brain would have been squashed beyond repair.
Causing any significant pressure.
Now, with the bone removed, her pressures are lower.
We'll go around to ICU, talk to her parents.
But it's good news tempered with bad.
We're not out of the woods yet. As I said to you a few days ago, that we don't know how good she's going to be mentally, you know, when she gets over it. But I'm still optimistic. I really think we're going to get her over this. That's what we're aiming for.
And then the news gets worse. After 2 stable days, Christy's brain pressures are up again.
She's really walking a knife edge at the moment. Things are really difficult. We're struggling a lot to keep things under control. The pressures in the brain were going up literally in front of our face. The area where they've taken the bone off, we could literally see that swelling. It can't stay like this for too much longer. Her brain will swell to the point where she'll die.
There's a lot of things going against her at the moment. She's fighting for her life. And we can't predict exactly what's going to happen. And we try and do our best for each patient. You know, and if we feel that their brain is just so badly damaged that they're not going to make it, you know, we would say to the family, honestly, look, we think this patient is really, they're just not going to do well. They've got no future.
It might be time to have that conversation with Christy's mum and dad. But they need to be certain.
Trying to get another CT today just to see if we've got black brain, and we might have a better idea of prognosis.
We're going to take Christy off for a scan of her head. There may be some features on the scan that will give us an idea of what her chances of recovery are.
The scan results will help guide everyone toward the best decision for this once vibrant and fun-loving young woman.
Lord, we specially ask that as Christy sleeps that you take away any pain and discomfort. Walk with her, fill her with your love, and give her peace. Lord, we know that you love us, that you have the power to heal, and because of these things we ask for a miracle.
5 weeks ago, Simon was in the Alfred's ICU suffering from seizures. Tonight is the first time he's really given his voice a run since he's had the breathing tube out.
Seeing Simon on stage tonight makes me feel so hopeful. He bounced back yet again. He's confident, he's happy, and he's doing what he does very well.
And I know it's my own damn fault.
It's his life and it's his love, and we're very proud of him.
Next time in the Alfred's ICU, can a miracle happen?
Esther, can you open your eyes for me?
The important thing at the moment is to keep the pressure down in her brain.
The signs were never there that we should give up.
Lord, as Christy sleeps, give her peace.
David developed a thunderclap headaches.
A bit delicate because you don't want to rupture the aneurysm.
There's some blood free in the brain.
You kind of know when it's like life-threatening, don't you?
Margaret required a cardiac transplant.
As you know, she can go either way. We look to see if there are any abnormal cells. They're a sign of rejection.